Good morning, good afternoon, everyone, and welcome to a Mental Health for All webinar. We're really delighted to have so many people registered. I think we have over 1,000 people registered for this session, and I'm expecting to see lots of people from lots of different countries. So thank you, everyone who's already been introducing themselves on the chat. It's lovely to see where you're all from. Already, it's a great range of different places across several different continents. My name's Sarah Klein. I'm the co-founder and CEO of United for Global Mental Health. We're an advocacy organization working to improve mental health around the world. And we have the great privilege of working closely with the World Health Organization. And we're very honored that they asked us to set up this webinar in order to have a discussion about the Mental Health Atlas that has been launched, and also the Mental Health Report that's been updated with new information around various elements of data. So you're going to hear from a couple of different people about different aspects of the work, what's called the Mental Health Today report, as I said, and the Mental Health Atlas data. We've got an excellent panel here. I'm just going to briefly introduce them. So from the WHO, you have Dan Chisholm and also Mark van Ommeren. As a data user and advocate, you have Stephanie Whiteman, who is from the University of a lecturer in public health at the Facility of Medical Sciences at the University of the West Indies. Another advocate and also a funder of mental health work is Preeti Sridhar from Marawala Health Initiative in India. And then we're hoping that Dr. Paris Wambui will be able to join from Kenya. And she was actually the focal point for the Kenyan government in contributing to the Mental Health Atlas and is able to speak about data and the use of data at a government level. So I'm really pleased to have everybody here. Please note that there is a chat function where it's been great that you've been putting your names and where you're from. And then also there's the opportunity to ask questions. We will also, over the course of this webinar, hold polls to have an interactive section where you're able to respond to the information that you're hearing. But first of all, what we'd like to start with is a presentation by WHO, and this will walk us through the latest global health estimates. So what's in World Mental Health today, and also what's in the WHO Mental Health Atlas. And together, these reports will give us a good understanding of what is happening in mental health and what the future of mental health might look like and what we can do. So over to you, Dan. Thank you.
Thanks so much, Sarah, and thank you also for working with us on the launch of these newly released reports. Yeah, it's a bit unusual for these sessions to have a presentation, but given the nature of these two reports, full of facts and figures, data and estimates, we thought it would be helpful to provide an overview and hopefully excite you enough to then go in and take a closer look at the more detailed results. To try and keep things simple, we've got one presentation and one speaker, which will be me initially, but of course I'm joined by my colleague Mark, as already introduced by Sarah. And both Mark and I would like to, of course, acknowledge the work of many colleagues in WHO who've worked on these reports, but perhaps particularly Anna de Graaf and Audrey Fontaine, both of whom are lucky to have as junior professional officers in the department. And of course, finally, I'd like to mention Deborah Kestel, who's our director and oversees everything that Mark, myself, and everyone else in the department does. So with that, let me move to the presentation. And the first slide here. So these are the two publications that are being released today, and we'll just take you through some key findings from them over the next 15 minutes. Starting with the World Mental Health Today. This is an update, in fact, of a chapter of the World Mental Health Report, which was published back in 2022. And if you haven't taken a look at that, we strongly recommend you do. It's got a very accessible way of explaining and outlining many of the key concepts and structures and frameworks in public mental health globally, as well as lots of country examples. This report, of course, contained this data chapter called World Mental Health Today. And of course, data does become outdated over time. So what you're seeing today, the World Mental Health Today latest data report, is an update of many of those facts and figures to ensure that we have up-to-date, fresh information to circulate. And the main data sources, as you see there on the left, are WHO's global health estimates for 2021, the global burden of disease studies, also latest data from 2021, and then the mental health atlas, which we have brand new data today. So this is also contributing to this World Mental Health Today report. So that's the overlap. So move to the next. So let's just dive straight into some numbers. This is the epidemiology part, looking at the actual prevalence, estimated prevalence of mental disorders, as shown, a whole series of conditions with varying degrees of prevalence. Two of the most common conditions are depressive disorders and anxiety disorders, both contributing more than 300 million people globally. And those between them account for nearly over 2/3 of the total estimated number for 2021, which is around 1.1 billion people. So back in just when the World Mental Health Report was published in 2022, that was using 2019 data. The estimate then, I think, was 970 million. So we see a quite substantive increase over that time. And if we think about the whole world population of around 8 billion, we're looking at about nearly 1 in 7 people living with a mental disorder globally. Some of those changes are shown here between over the last 10 years. So this is looking at how much, answering that question, have the rates of mental disorder increased over time or not? Well, the answer is yes. You can see that by age group over on the right-hand side. And particularly alarming, perhaps, is the increase. The largest increase we see among those age groups is among people aged 20 to 29 years old, who've gone up by an absolute amount of 1.8%. So these are very huge numbers when you think about it. They're 14% of the population globally. Now let's move to the mortality. And several statistics here, but we start on the left with the excess mortality. So people with mental health conditions are dying much earlier than people without mental health conditions, so shorter life expectancies. And that's particularly true for people living with more serious, enduring mental health conditions like psychosis. And that's often not due to suicide or anything cause specific, you could say, but it's due to often neglected physical health needs. Moving to the right-hand side and suicide. So these are the latest estimated numbers for 2021, that over 700,000 people died by suicide in 2021. And that represents roughly 1 in 100 deaths globally from this cause. Over half of those deaths occur before the age of 50, and in the younger age group of people between 15 and 29 years old, it's actually the second leading cause of death. A bit more positively, you could say, there has been a notable drop in the rate of suicide since the year 2000. But we have, as you may know, a Sustainable Development Goal target around suicide, which is a 30% drop, and we are far away from achieving or being on track to meet that target. Moving to the public health impacts, also often described as disease burden, although we try to avoid that term for obvious reasons of being seen as pejorative. So this breaks down into both the mortality and the morbidity aspects, and you put them together into these things called DALYs, disability adjusted life years. And if we consider the total burden of all disease, deaths and disability due to different diseases and health conditions, we arrive at about 5.2% of the global burden. But much of that burden is actually in the form of the years lived with disability. And mental disorders account for actually 1 in 6 of all years lived with disability globally. And you can see there in the chart that they account for some of those specific conditions. So like, for example, depression is the second leading cause of disability globally. And when you look at the younger age groups, like for 15 to 29-year-olds, it's the leading cause. And you see anxiety is number 4 cause of years lived with disability. So these are huge contributors to overall levels of health loss. Then we have a little section on the economic consequences of these conditions. And on the left are some statistics around the estimated economic burden. So, for example, 12 billion productive workdays are lost each year to depression and anxiety at an estimated cost of $1 trillion US per year. And when we look at national investment case studies and look at the burden that in those situations, often we are coming up with estimates of between 0.5% and 1% of national gross domestic product as the accumulated cost and loss associated with mental health conditions. Looking at the implications of that, the household implications are particularly important. As shown in this set of graphs, in this graph, we have a big issue around the lack of financial protection for people affected by mental health conditions. So you can see that in low-income countries, more than half of the countries are not having mental health included in their publicly funded health or financial protection scheme. So that means who's left to pay for the services and care that people need? It's households themselves. So we often talk about, philanthropies and external donors and so on. But in many countries, particularly low-income countries, it's the government, if you're lucky. Otherwise, it's left to individual households and individuals and household members to pick up the cost, which is obviously very inequitable. Now, the World Mental Health Today publication finishes with plenty of facts and figures around the gaps in services. In fact, not just services, but in terms of resources, weaknesses in governance, lack of strong information systems. So this is my segue, my move into the second of the presentations, because many of these issues, these gaps, are addressed by the Mental Health Atlas project. So I will move into that second step of the presentation at this point. So for those, Mental Health Atlas has been around quite a long time. The first edition came out in 2001. So we're on to the 7th edition of this periodically administered survey to WHO member states with the idea to collect information on policies and legislation, about services and resources, so that we can understand what where countries are at and where whole regions are at. And then it sort of assumed a new level of importance from 2014 onwards, because we have a comprehensive mental health action plan complete with targets and objectives. So the Atlas project has become a way for us to monitor progress towards those global objectives and targets, so that its information value has taken on a new level of importance. In this year's publication and edition, these are the main sections of the report. So you see it's covering those gaps that I was showing just a moment ago about what's the situation with regard to information systems and ability of countries to report on mental health. What about the governance, by which we mean the policies and plans? What do countries have? How strong are they? How well are they being implemented? Are they compliant in line with human rights instruments? When we come to the financing and workforce, we focus on public financing. We've tried in the past to understand about all forms of financing and somewhat failed. So we're focusing here on government spending, and I will show results in a minute. And then for mental health services, looking at inpatient care and outpatient care, but also some other aspects of service development for example, in levels of integration with primary care. What is the situation with respect to moving away from institution to community-based service models and so on? And then finally, a section on mental health promotion and protection programs, as well as prevention of suicide. Now, one important point to start with is the participation rate. So you'll see here a bit of a drop between this year's participation rate in the Mental Health Atlas compared to some of the earlier editions. So this is obviously a disappointment, partly down to maybe fatigue with surveys from WHO and other international bodies, or partly also there were competing surveys taking place, been undertaken by other international organizations at the same time in some particular regions. So it's that's disappointing. I mean, it's important that we have very strong response to these surveys, but we're relying on the good offices of the ministries of health who appoint focal points to undertake the completion of these surveys. And at the end of the day, we still feel we have a very strong representation, 144 countries, to be able to describe the current situation both globally and regionally. So in the time, we just give you a couple of glimpses, some illustrative findings from some of these sections. So starting with policy and legislation, this is showing the proportion of countries who responded to this version, this edition of the survey, who are reporting full compliance of their mental health policy and law with international human rights instruments. We have a little checklist which we ask focal points to complete, and we use that as a basis for scoring compliance. And you see on the policy side, there is a clear kind of improvement, a tendency for more compliance with rights-based approaches. For the law, it's a bit different. It's a bit more stagnant. It's almost like, well, from last time in 2020, there's no apparent change or improvement, which again is somewhat disappointing to see, given the availability of guidance and the attention to mental health in COVID pandemic times and since. So it could be reflecting a bit of a lag. Maybe we can expect to see improvements in this over the coming years. Moving to resources. On the left-hand side, this is showing the latest estimates for the median number of sort of professional mental health workers, specialized mental health workers like psychiatrists, nurses, psychologists, and social workers. Again, over time, there's some kind of indication of a small but slow kind of improvement in the availability of mental health workers. This is per 100,000 population. So globally, it's reached 13.5 mental health workers per 100,000 population. On the right-hand side, it looks a bit complicated. If you look on the right-hand axis, it's showing the percentage of government's overall health budget that is allocated to mental health. So this has remained stubbornly stuck at about 2% globally, but you see these quite dramatic differences between particularly countries at different levels of income. So it goes up to about 4.5% in high-income countries versus a median of less than 1% in low-income countries. On the left-hand side is the actual amount of expenditure per capita, and it ranges wildly from more than $50 or $60 per capita in high-income countries to less than $1 per capita in many low-income countries. Moving to service development and integration. So you see on the left-hand side here, this is actually a new question we asked this time, asking countries where they see themselves being on that transition from hospital to community-based services and care models. And just over half a report being actually only at an early stage of transition, and 20% report not really starting that transition at all. So that's 72%, or 70, is it 73%, 72, 73% in that phase, and only 9% report actually having completed that transition, so that the services are exclusively or highly predominantly community based. On the right hand side is about the integration of mental health into primary care services, and on some indicators it's quite encouraging. Like you see at the top that 90% of countries report offering training of healthcare workers on management of mental, neurological and substance use conditions. But if you track down to the bottom, you'll see that when we ask questions about, well, do a large proportion of the primary care centres have pharmacological interventions and psychological interventions, the numbers drop off, particularly for the availability of psychological care and treatment and services. Less than 20% of all the countries that responded this time round. We asked some questions about, for example, telehealth. This is quite encouraging. Around 2/3 of countries responded to this, saying yes, they do have mental health services available in the country. But you see this steep gradient again by income level. Another very encouraging indicator was around mental health and psychosocial support in the context of emergencies, and this has gone up substantially since the last edition of 2020. Again, around 2/3 of countries report having a mental health and psychosocial support component of their emergency response or disaster risk management plans. And finally, of the illustrative findings around mental health promotion and prevention, this is one of the key questions we asked to monitor how countries are doing, to at least have a couple, two functioning programs of mental health promotion or protection. So it's around 2/3 of responding countries report having meeting those criteria. But that's still implying that 1/3 do not, right? So that's also at the same time a worrying statistic. Overall, we have this graph at the beginning of the report, which sort of summarizes some of the global targets that member states have signed up to, and reports the findings from the last edition of Atlas compared to this edition. And you see a bit of a mixed bag of results, some small improvements in some areas, like I mentioned just a moment ago about mental health and psychosocial support. But you also see some stagnation or even regression in case of the legislation, small reduction in a number of countries saying that their laws are compliant with human rights instruments. Now that could partly be explained by not so much the smaller number of countries that participated this time round, but the distribution of those countries. So some of the countries that did participate last time, didn't participate this time, but did last time, may have influenced these findings. So the final slide is what does this all mean? We can discuss this, Sarah, but some of the obvious ones for us, are that some of these targets, are off track, and so the implication is that countries do indeed need to get a lot more serious about mental health service investment and action. Some of these backslides with regard to legislation, for example, are worrying trends. So please do go and take a look at these publications and get in touch with us if you have any particular questions as well at the contact address there. So thank you very much, and back to you then, Sarah.
Thank you, Dan. That was a lot of information, really useful information that we can all use in our work. A couple of things. One is I really appreciate the questions and comments you've already had in. So if you go to the right-hand side, people will be able to see the chat. Antonis has just added the information where the links are. So if people would like to look at the actual publications themselves, please go ahead and take a look at those. And there's also the press release from today. And lots of applause for the presentation, Dan. We also decided to do a poll, so it'd be good to hear from all of you in the audience. It's about 400 plus people here live right now. What do you consider to be the interesting points? But maybe we'll start with, based on what you've heard today, which of the following do you find most surprising? And there's some statements from the documentation that are there. So we'll open the poll shortly, and you'll be able to, if you click on the poll, it's on the right-hand side, you can vote about which ones you consider to be the most surprising or the most unexpected of the things that we've heard. And while people are considering that, Preeti, do you want to say, was there one thing that you found surprising, something that you weren't expecting to hear?
I think from a positive point of view, I would say I was surprised to see that 72% of the countries are reporting full compliance on their mental health policy. Slightly disappointed that the number of countries that are working on probably upgrading their mental health laws have not changed, but definitely a first step in terms of compliance on policy adherence.
It's good to hear. And Stephanie, which were some of the things that you found surprising or interesting that you maybe weren't expecting? Can't hear from Stephanie. I'll ask Mark. What do you think? When you got this information and first had a look at it, what were the things that you found surprising?
I had thought of all the commitments that member states have made over the years, that the median of budget would have gone up. And so that was surprising. It means there is more work to be done, more advocacy, probably with the ministers of finance would probably be a good place to get this number up. But we need the number is, I would have liked to see the change and expected the change actually.
And were there any things that you thought were positive or that looked better than you were expecting?
I thought the preparedness for emergencies looked better than I had expected. I was quite pleased to see that. Yes, there is there's many positive things happening. The engagement in mental health in the world is really going up, but the data don't necessarily show that yet in the indicators. That's a pity.
Yeah, I think there's some. And Dan, just to add to your thoughts, I mean, you've now seen the data extensively. What did you think when you saw it? Were there things that you were surprised by?
I'd love to say I was surprised, but actually I wasn't too surprised by the. These are medians, so there's a lot of flattening that goes on in this kind of analysis. So I wasn't too surprised to see these very modest changes in terms of policy and investment. Where I think what I see is a big distinction between kind of policy level indicators. We're showing, more awareness, more engagement, but the kind of relative lack of translation into services and workforce. There's still that gap, right? So that's what I kind of take away from this is that there's quite good engagement and people are increasingly aware about mental health and need for appropriate policies and plans. But those plans are still not being sufficiently, equipped and implemented. But over to Stephanie, who's back.
Yes, definitely. Thanks, Dan. Just reflecting on surprises or things that you may or may not have expected when you got seeing the data now.
Yes, sorry about the dropping off. To me, one of the most significant data points that came out of this report that stood out to me was the lack of progress in allocating the sufficient national budgets to address these mental health concerns. Being stagnant at 2% really leads to limitations in service provision, limitations in workforce, lack of clinics, and if we don't have increase in our budgets and our investments, we're not going to see the progress that we need, despite the overwhelming burden that we are seeing from these reports.
Thanks, Stephanie. Well, I think I'm going to close the poll there, and I can tell you that over 50% of those who were polled agreed with you all, that really there's a big surprise around the lack of funding, or not the increase in funding, I guess, because it's still, as I said, a percentage of, it's the mental health as a percentage of health spend, I believe, and it's that isn't changing. So within the health sector, more investment isn't being put to mental health. So I'm going to leave that there. There is a second poll that we'll come to shortly. But meanwhile, I wanted to go back again to a little bit more of the detail of what you've heard today. One of the things that we heard at the beginning, which was also a bit disappointing, was that there was a lower number of countries actually taking part in the Atlas data collection this year than we'd seen previously. And I wondered about the challenges of collecting data both for countries and then perhaps in the collation of data for WHO. But Stephanie, did you want to speak to that? Was there? We would have asked Paris, but unfortunately she's not able to be here. But I know that you've worked quite a lot with government at a national level around data collection. What are the challenges with getting this kind of data together? Why is it difficult to gather the data?
Thanks so much for that, Sarah. I think especially in small island countries, in lower middle income countries, being able to collect that national level data is quite onerous. And many times we have a lack of human resources and even financial resources to conduct those surveys that we need to report to WHO on. And I think that is a major contributing factor to not having the sufficient countries to be able to report. Having a look at the mental health atlas, only about 11 Caribbean countries were able to report, which is quite disappointing because that's where I'm from, and I would love to see more of our islands being able to report because that's where we can track our progress. But I think that's some of the major ways, that lack of human resources to be able to collect it, as well as the financial resources as well to allocate the time to do it. In many smaller countries and poorer countries, we have very small ministries of health and even smaller departments that focus on mental health to be able to do that data collection. And all of that, trickles down from, again, that 2% of the budget being allocated to mental health. So I think that's some of the constraints that we're having right now.
And thank you. That's really helpful context, Stephanie. And so the challenges at national level, I guess then as a counterpoint to that, Mark, what can we do to strengthen mental health information kind of gathering? What's the sort of things that WHO offers, perhaps national governments? How do you help people gather data?
I think this is a good question for Dan, actually. So just to
Okay, Dan.
on the data, that's his. Dan, but Dan looks frozen on the screen. There.
I'm not frozen. I will send you a message about
Ah,
a question that's come in about disorders that you might want to address. But basically, I mean, countries do get sent a lot of these kind of surveys. So that's one constant demand be made on us and hopefully other international organisations. Please stop sending through any questionnaires to fill in, particularly small countries which might have very modest workforce to address these surveys, as I think Stephanie was alluding to. But the other point, of course, is that we have maybe a submission of a profile, but it's half empty, and that's often reflecting the lack of good data upon which to make a submission of data about spending, about extent of integration in mental health into primary care, and so on. So this is another clear implication of the urgent need to improve information system, particularly at the routine level where much of this data needs to be collected.
Thanks for that, Dan. I think now I'm going to dive in a bit to the actual data itself and what we learned. So there are a couple of questions that have come up in the chat that I just wanted to talk about. One of the questions that we saw was around definition. So this idea of using conditions or disorders, I think that was one that Dan, Mark, perhaps you could answer. So when WHO is even framing the questions around data, why are you using the term disorder? When do you use condition? What's the decision being made there?
okay. Well, the WHO uses for all health measurement uses the ICD, and that's a diagnostic system for diseases and disorders. So when we look at prevalence rates, we communicate about disorders. When, however, in the mental health community, there has been increasingly discomfort with the language around disorder, and the term condition has been much more widely accepted. We have a definition of mental health condition, which is a broader term than disorder and a little bit more fluid. And that term works really well in our communications in general, but doesn't work very well when we want to come up with when we want to report on numbers, because you need for it to count something you need very specific definition. So then we return back to the ICD definitions. So that's how we manage this. It's very difficult to use the language to the satisfaction for everybody. In fact, I think it's impossible. But this is how we have addressed it in more recent years. And
Thanks, Mark.
hope this is helpful. Yeah.
Yeah, no, that's very helpful. And then Anne from UNICEF asked a clarifying point. When you're talking about mental health workers, were those being counted across all sectors, or that is in the health sector? So who's reporting on the number of mental health workers?
That's a question for Dan.
I can answer that one. So, each country appoints a focal point, normally in the Ministry of Health. So they're the ones filling in the survey. They are strongly encouraged to consult with, collaborate, and acknowledge inputs from other colleagues in and across other sectors, and many countries have done that. So specifically, the question says, how many the different types of worker do you have working in government and outside government? So we're not being specific to the health sector. We're asking about the whole government workforce. But we, like I just said, appreciate that some countries would likely struggle to get all of the information to capture that, particularly at the subnational level, numbers people working maybe in social services who actually do mental health work. So I think we could reasonably say it's a lower estimate, of the total input. Just like spending, we'd ask about spending, but what about the spending in primary care? Which may not be given a badge, a name, a label, a line, which is called mental health. That's not how expenditure is often allocated in that sense. Over.
Maybe I can come to one other part. I think what a lot of people are interested in, and I certainly was asked before this, what has the number of people living with a mental health condition increased? Is prevalence increasing, or is it that the population is increasing and the proportions are staying the same? So this question's been asked a couple of different ways. It'd be good to understand that. Is it that the population's growing generally, or is it that the numbers are growing relative to the size of population?
Both is true. So the populations are growing, and because of that, the prevalence is growing. But the prevalence is growing slightly more than the population, and that is the first time we reporting that. So when last time we reported, we 3 years ago, our report was that the prevalence was increasing the same amount as the population, and the biggest increase that is reported is on younger populations, young adults, 20 to 29, and it's close to 2% on what they had before. So it's I think it goes from, on top of my head, from 14 to 16 or something like that. That age group. We have to look it up if you want to have the exact number. It's in the report. So relatively, that's quite a bit. And the challenge, of course, for interpretation is that this was in 2021 data, which was COVID year, which is unusual year. It may be the beginning of a longer, not the beginning, but it may be worse now. It may also have recovered a bit. But overall, the trend is that things are getting worse. The most common question we get, of course, is why is it going up? That's the I don't know, $100 million question they used to say. I think it's more than 100 million to answer that, but it's a big question. And but the two dominant explanations are a relationship with technology and the impact of the COVID-19 pandemic. Those are the two most common explanations.
Thank you. Preeti, you've been listening to some of the discussion here, and I've seen a few questions that you might be interested in, but was there any aspect of it coming from India? And there's someone else who's asked us about disaggregating data beyond national to either, well, in the case of India, statewide data. Are there things that strike you from this that would be relevant for India, or is it India such a big country that just having data about a country isn't sufficient?
So I think for me, when it comes to mental health data, and as a funder that works on funding mental health services for marginalized groups, I think there is the information that is being sought is more relevant for systems that are stronger, the health systems that are stronger. It's a very biomedical data points being collected, and it requires certain kind of expertise to collect this data, because you're asking about psychiatrists, psychologists, I think adding to what Stephanie was saying, in a low resource setting, these numbers don't change overnight, and there is no incentive for the government, because you're not going to increase number of psychiatrists over the next 5 years so significantly. And while WHO has started talking about social determinants, has talked about psychosocial approach to mental health and a human rights approach to mental health, I think those as indicators would be good to have. and I think there is then a lot of data that can be made available through departments that are not limiting themselves to health. And I think then there's an incentive to show shifts that are happening in terms of care models.
Yeah, so this idea of collecting data beyond what's in the atlas and looking for other sources, is that one of the things? I think that's come up a bit in the discussions as well, I can see from the panel. One of the things Shani asks Dan or Mark is, will the atlas country profiles be available? And she says, I truly hope so. These are often the only source of publicly accessible mental health data that citizens can obtain from their ministries.
Thank you very much for the question and the opportunity to announce that yes, they will be available. We are in the process of generating those profiles. There is a lag because we have to go back to the countries, the focal points, to have them cleared and approved from the national side. That can take days, weeks, or sometimes months. So we will just, as and when we get the validated data, we post them up to the website. So it'll be a kind of, it'll come out over the next few weeks and months. So yes.
Thanks, Dan. I'm going to open, we have a second poll that we have. From your perspective, or in line with your work, which of some of the facts and figures do you think are most important to address? So I'm going to open that poll for people to respond to in terms of things that they think are important to address. I think one of the things that's come up as a question, and I don't know whether Dan or Mark, this is one that you could speak to, but there's a question here about considering the future of mental health and well-being. Are we moving towards a more holistic model, which might include hope therapy, faith-based approaches, lifestyles that enhance mental well-being? I think this is interesting because, as we know, there's such a spectrum in terms of what good mental health looks like and what people need in order to have good mental health. And maybe we can link that a little bit to the holistic sense in which I know you've talked about the link between physical and mental health, and with the high level meeting around the corner, I think some of what this refers to is when it gets to health well-being is around the link between physical and mental health. So is there more discussion of that? Is there more encouragement of those kind of models which are sort of beyond the clinical or the biomedical approach?
I think the lifestyle approaches, there's even a term called lifestyle psychiatry, it's a rather unusual term, but it is there. I think the lifestyle focus will get a lot of emphasis in coming years. So I think that will be, I see that a great future for that approach being very much endorsed in many endorsed and part of protocols in future years, and that will make it more holistic. There's also, of course, the approach that is implicitly here under criticism is the biomedical approach. There is a lot of interest these days on which is focused on problems. These days there's also a lot of interest in strengths-based approaches. So you see the rise of the acceptance and commitment therapy. You see approaches that are more strength-based, and I think there's a future for that. For WHO, we are very much expected to work evidence-based. So we are, that's how we're governed. That's what the governments want from us, and that's what the public expects from us. So we will always be looking at whether there's good evidence for that. I think the field will become more holistic over time.
Thank you. That's good to know. In terms of things that people will be wanting to work on in the future, we've had about 85 more people putting their votes in. For each of you, are there particular aspects of what you've learned from this data, or where we've got to in terms of things that you will be looking forward to working on, or you recommend people should work on? Stephanie, were there aspects of what you've heard today that are going to be important to you for your work?
Hi, Sarah. Thanks a lot for that question. And definitely so. I do a lot of work within in advocacy as well as within academia. And I think through these reports, we have been able to pinpoint and encourage more areas where we need more advocacy. So when we are looking at the prevalence rates, the overall prevalence rate of that 14% of persons globally having a mental health disorder in some way, that's a billion persons. And despite that, when we are looking comparing males to females, we see that females were reporting having higher rates of depression and anxiety compared to males. But however, males are twice as likely, or twice as many males die by suicide compared to females. And because of that, we're simply not doing enough. And that just encourages or really underscores the need for more advocacy against suicide to help address these suicide rates, especially amongst the male population. And then also another aspect that stood out was the fact that within our region and in my work in mental health advocacy within the Caribbean region, within the Americas, was that despite the global suicide rates decreasing, which is great by 35% from 2000 to 2021, my region of the Americas, we actually increased and we went against the grain from everyone else and we increased by 17%. Again, underscoring the importance for advocacy within our region, and the fight is not over. And we still need to work harder in order to meet those SDG goals and to meet the global mental health targets of decreasing deaths by 30%. So we have a lot more to do within that realm as well. So that's where my work is going to be focused.
Thank you, Stephanie. That sounds really important. Preeti, looking at the data, are there things that that you feel you or your organisation will focus on?
I think for me, of course, getting the India data would be important, but just looking at transition from hospital to community-based models of care would be a good point to talk about, because in the context of India, one, there are limited mental health services. Two, mental health budget, like every others have mentioned, is 1% of the total health budget. But within that, it goes to tertiary hospital care, and those are institution based care. And people don't have, there is a lot of abandonment that happens when people get admitted into mental health institutions, and therefore deinstitutionalization is important issue to work on. And it would be good to see what kind of data India has provided on this transition care model. I think it would also then serve as, I would say, to start conversations on need to work on prevention of mental health from community-based models rather than, institutional models of care. And I think the third aspect it will help do conversations is look at mental health support beyond medical treatment, to look at, is employment being taken care of? Is access to education being taken care of? Within institutions, are human rights being ensured? And yeah, so I see that as a good starting point to do a whole lot of conversations.
Thank you. I think one of the things that really struck me was that I think something like more than 1 in 5 admissions to psychiatric hospitals are for more than a year. That ties up quite a lot of budget that could be much better spent. If nothing, if we're just talking about money, which seems to be a concern for everyone here, I think part of it is there doesn't seem to be a lot of changes in the mindset of how a mental health budget is constructed and the amount of money that's going into institutions, which could be freed up and used in other ways. Um, I think I think that's really true. Appreciate that one of the most important parts of this whole body of work was around the importance of really emphasizing community-based care, because it's the most off track, it seems, of the progress in terms of the comprehensive health action network, comprehensive mental health action plan. In terms of what you see, actually the community-based care is very off track, and it was good to have the new indicators that we've got in this atlas that speak to some of the data around how long people are there, what's happening to them. So that was really interesting and really useful for our work. Was there any areas we're coming towards the end, but just to say, looking ahead now, we've seen from the polling that the points that people are looking forward to working more on, or they think is more important to address, again, about half are saying funding and changing levels of funding. Also, just the sheer scale of the number of people now estimated to be living with a diagnosable mental disorder. And then the point that we've been discussing around compliance, so mental health legislation, compliance with international human rights standards, and positively this point about having support across mental health. 2/3 of countries have mental health and psychosocial support systems in place, so that's going up, which is a good thing. There's a couple of questions I'm just going to quickly turn to before we close. One was, and I don't know, maybe Dan, based on some of the work you've done on return on investment, could help with this. But Aidan asks, how can a company or other entity demonstrate financial returns from improved mental health services in an effort to increase investment?
They can do a study a bit like we've done for whole countries. You can look at your workforce. You can see the number of your employees who are affected one way or the other by some mental health needs or issues. Whether out of work, we talk about absenteeism, we also talk about presenteeism, being outside, the workforce entirely. So these kind of calculations can be made quite readily. And you look at the cost of a wellness at work program, employee assistance program, tend to be pretty modest, and you'll see that you could potentially get a very reasonable rate of return on improved mental health in the workplace.
Thanks, Dan. I'm going to come to the end now, so I'm going to ask you a very simple question. If you could try complete this statement. So it's at tweet length. Mental health advocates should use the WHO Mental Health Atlas to something. Stephanie, I'll come to you first. Stephanie might have frozen, so she's bought herself some time. Oh, there you are. Stephanie, are you able to respond?
Apologies, I froze for a bit. Can you repeat?
I was just asking if you can complete the tweet length sentence. So mental health advocates should use the Mental Health Atlas to...
I think mental health advocates can use the Mental Health Atlas to track our progress, encourage more advocacy, and push our governments to do more.
That's perfect, thank you. Preeti, would you like to add your version?
Mental health advocates should use the Atlas to initiate conversations on mental health, need to integrate it into existing government programs, and ask for increased investment in prevention model through community-based interventions.
Thank you. Mark, do you want to add anything to that?
Yes, but I'd also like to thank you for providing and providing this platform for this work. So thank you and the Global Mental Health Action Network and United for Global Mental Health. But the question is what to do with this material. I think the place to advocate is with the ministers of finance. They're the ones who allocate the funding for mental health. Please, that's where you should direct your advocacy.
Thank you.
At most.
Dan, do you have
We
anything
speak
to add?
with one voice, so I can't say anything more than that, can I? What I will do though is put in the chat a couple of links. We've been very much working on financing, as you know, and so a couple of links to the thinking and the ways in which countries can increase their mobilization and allocation of resources for mental health.
Thank you all very much. I'm really pleased to have held this session today. So United for Global Mental Health is the Secretariat for the Global Mental Health Action Network. It now has about 7,000 members all over the world. It's great to have a cross-section of people here. Thank you very much for joining us. We'll continue the conversation about this topic on Circle, which is the intranet available to all members. I think it has about 1,000 members on it these days. Look out for more information on more webinars, more discussions, and the sharing of more information as we have already in the chat. And we'll keep going with that on social media. But thank you all very, very much, and particularly thanks to the WHO team and for the huge amount of work that's gone in to these documents. They mean a lot to all of us and are incredibly important to our work. So looking forward to hearing more from all of you as you take forward this activities using these documents over the coming months. Take care. Thank you very much.